Visiting Nurse Association Hospice Program, it's an incredible program. It's one of the most wonderful things we really do in healthcare. We bring nurses, home health aides, social workers, chaplains to people's homes, to hospitals and nursing facilities to help them deal with difficult end-of-life situations. The hospice staff works with individuals with terminal illness who are near the end of life. It helps them remain comfortable and independent, have that period of time in their life be more comfortable and more filled with dignity rather than suffering. We're trying to reduce suffering. We're trying to help people live out the remainder of their days with as much comfort and support as possible. And a lot of the help, a lot of the work done by hospice is with the family. It's to help the family help their loved one and also to help cope with the challenges they're facing with this transition in their lives, this difficult time. In hospice care, it doesn't just end at the time that a patient passes away. It also extends beyond the time that they're with us. We have bereavement services. This is a holistic program that helps families. It helps individuals suffer less, live life to the fullest for whatever they have left. And it's the holistic nature of it can't be overemphasized. We have music therapy, bereavement services, pet therapy, and it's those things, actually, some of those more holistic additional things that we do that really make this a special program, and that requires support. Those additional services, the extra step that we're able to go, the additional training and resources that we have for our teams requires community support. It requires philanthropic support. So your efforts to support hospice care are making sure that you and your families and the community at large continue to have access to this great care, this holistic care that both helps the patient and their families. It's really an incredible thing. Can't thank you enough for your support and for your enthusiasm for hospice care.
I graduated from Holy Name Hospital in Teaneck, and I worked in various places which I didn't feel at home. Somebody told me about the VNA, and I went and I had an interview, and I started to work immediately. Got my uniform, got my bag, got my pack of newspapers, and off I went to home care. When I started with the visiting nurses, I didn't drive. I walked, I carried my bag, and I walked in rain, I walked in snow. I walked from home to home, different parts of town, and that's just the way it was. When I came down here, there was nothing to do. I felt lost. So the funny thing was, I got a call from a VNA nurse, and she said, "Would you be able to help us out? We are changing from paper to digital, and the nurses have to be in the office for all of this, and we have to get the blood pressures for the seniors done. Do you think you'd be able to do that for us?" And I said, "Sure." I was like thrilled. So I went and I did the blood pressures and stuff, and I joined the thrift shop, and I loved every minute I was there. I probably worked in the thrift shop once a week on Tuesdays. People would stop and say, "Why do you do that?" I just stop and tell them it's the most wonderful thing to do. It does so much good for so many people, and that's where I spent my time at the thrift shop. The people were wonderful that I worked with. They were pretty much the same as me, seniors, and looking for something good to do. and I would still be working in the thrift shop. However, I became ill, so I couldn't do it anymore. There's just one other thing I would like to say about the VNA. I have come to know it as an employer. I have come to know it as working in the thrift shop. And I have also come to know it as a patient. And I have been taken care of by such good women while I was recuperating. And if anybody ever asked me about the VNA, you know I could tell them anything. Thank you.
So what do I recall about when my mother worked for the VNA? I was in probably 5th grade when she started, and it's when she decided to go back to work full-time, and she didn't want to be a hospital nurse, and she was just so taken with the idea of working as a visiting nurse so she could have closer relationships with the people. But my mother didn't drive at the time, so what I recall was her having to carry these big heavy bags, and I guess she must have started in the winter because she had to put on these 4 layers of clothes, her blouse, and then there was a sweater, and then a blazer, and then this big heavy blue top coat. And what I recall was her leaving the house, and she would go to the corner to get on the bus to go down to her section of town where her patients were, and it seemed like half the time by the end of the day when she came home, she'd say, oh, there was no bus today. So then she had to walk all the way down to what we call the Bergen Point part of town, and then walk from patient to patient to patient. And so that would take some time, and especially walking down, so that would make her delayed. And so she had to do her charts, which was supposed to be enough time during the day, but she would end up at the kitchen table or the dining room table, one or the other, doing her charts while I was doing my homework. And so my mother and I would be doing our homework together. And she would just be, her face would light up because of how much she loved the patients. When Dr. Landers and Bridget Murphy came and asked me to serve on the board, it was just something I was delighted to do, A, because of the cost curve reasons, and B, because of what my mother's service to the VNA meant to me, and it was just the perfect opportunity to do so. It was clear to me that we needed to do whatever possible to bend the cost curve down, because healthcare costs were and are out of control, and a way to do that was to take as many patients as possible out of institutions and treat them at home. And so the visiting nurse, the VNA, would be one great way of doing that. People should support the VNA because what it does is it brings together a mission of compassion with the societal benefit of helping to drive the healthcare cost curve down. The home care that the VNA takes care of people as they're getting well. The other side is the hospice program that takes care of people, frankly, as they're not getting well. And they're not going to be getting any better, but it allows them, frankly, to end their life with dignity at home. And it makes it easier on the patient, but easier on the family as well. And hospice takes care of both. It's a full family experience. It makes it so much better for the patient and so much better for the patient's family.
My mother was a visiting nurse, I think, for 7 or 8 years in Bayonne, and I remember just being so proud of her every day on multiple levels. And I had no better feeling than when I see or saw, and still to this day, friends, acquaintances that ask me, Considine, are you related to the nurse in Bayonne? I would say that's my mom, and they would all say, well, she took care of my mother or my grandmother or my grandfather, and how wonderful she was with them. And there's no better feeling than that. On a funny note, this is a good story, and many of you who are here tonight will know the name Jim Devaney. He is somewhat of a legend in Bayonne and Jersey City, and had some stints where he worked at some of the watering holes here down at the Jersey Shore. But my mother in the beginning didn't drive. So my father would take her to the bus, and at times he would even take her on his rounds if he was off that day. And on this particular day, my father had a flat tire. So he asked Jim, who had a hot dog truck in Bayonne, and my mother, my father, and Jim Devaney made all of her rounds that day in his hot dog truck. Going in, visiting patients, making hot dogs with mustard sauerkraut out the window while he was waiting for her. So just so many great stories with my mother in that role. We've really come full circle. So my mother was really born to be a visiting nurse, her favorite job in the world. My mother has just come through some health issues, as you know, and she had wonderful care at home from her visiting nurse, and developed a great relationship with her, and we were so pleased with that. And I remember the last day how upset my mother was when she wasn't going to be coming back anymore. The good news is my mother's well, but she had a great relationship with that nurse. The dedication, my mother said it really reminded her of how she worked with her patients. So it was great to see. It really was full circle. She worked in the thrift shop. She became a patient for the VNA, and she loved every piece of that. From Horizon's perspective, the VNA is so important to us. What you're doing in the community is really so important. The hospice program at the VNA is really second to none. The way that the VNA, the hospice program, the care that they deliver to those that are at their end stages, those that are the most vulnerable, the way they are able to help and let those people maintain their dignity right to the end, it is really a wonderful mission, very much worth our support.
All my life I've known about the VNA, obviously from my grandmother's experience of being a visiting nurse before I was born, and from my grandmother working at the thrift store in Manasquan, where I've purchased a number of items, believe it or not. And it wasn't until I had my own personal experience with the VNA that I really understood the impact that they can make on folks' lives. My son unfortunately experienced a tragic accident when he was 18 months, and my husband and I were obviously faced with challenges coming home from the hospital that we were never prepared to face. I feel that the visiting nurse that we were lucky enough to receive truly was our guardian angel. I truly believe that everything comes full circle in life. From knowing that my grandmother made an impact from being a visiting nurse, I thought to myself, if only I could do half the service that she's done and help an organization that I know my family's been such a part of, especially to give back after the care they've given my son, that it was a home run for me. I learned that it's a wonderful hospice care organization, but it starts taking care of people at the beginning of their life all the way to the end of their life and everything in between. The VNA is an organization that offers so much more than taking care of people in the last days of their lives. Not only do they take care of children in medical emergency situations like my son, but they will help children with speech pathology and other early intervention. They truly think about every end of the spectrum when providing home health care for people in need, and I think everyone should support this great cause for our community.